Thank you so much for tuning into the program. I'm your host, Neal Howard, here on Health Professional Radio. What could be worse for a senior citizen than getting hospitalized and then having to go for rehab? Well, what could be worse is finding out that Medicare won't cover your rehab because of a technicality of some sort. Our guest today is Teri Dreher. She's an RN, also the author of Patient Advocacy Matters, the Ultimate How-To Guide. And she's returning here with us on Health Professional Radio to talk about her book and also about the Medicare Outpatient Observation Notice, also known as MOON. Welcome back to Health Professional Radio, Teri.
Thank you very much, Neal. It's good to be back.
Good. Now, you are a patient advocate. Give us a bit of background about yourself.
Sure. I worked in intensive care for about 39 years, and during the latter 9 years, I started to see a lot of changes happening in the healthcare world in general that were coming about because of the Affordable Care Act. A lot of things were changing in the hospital as cost containment became a greater issue, and I didn't feel comfortable with all the focus on the computer that nurses and doctors were having to go through, and it all became more about data and marketing and financial issues rather than patient focus. So I went through a couple of experiences professionally and in my personal life that showed me that patients really need to have an advocate these days, and people that don't have an advocate are really at risk, particularly older people that don't live close to their family. And I just thought, I can help people. So I started my own business in 2011, Ensure Patient Advocates, and we have 7 nurses now.
I've mentioned senior citizens, and you did as well, some of the problems that some of our parents and grandparents are facing when it comes to their health care. One of the bigger problems in healthcare today, despite some recent attempts to fix it, as I'm sure you will talk about, is that many senior citizens don't understand what the problem is, or that there is a problem until it hits us squarely in our finances. Talk about some of these technicalities that have to do with some of our payers deciding not to pay for certain things when we think they should pay across the board.
Well, absolutely, Neal. One of the most unpopular parts of the Affordable Care Act concerns something called inpatient versus observation. So people can be admitted now to a hospital in the same bed, getting the same care, and not really realize that they're considered observation status patients. And this is particularly a problem for seniors who may fall and break a hip or a leg or a pelvic fracture. They go into the hospital, they get admitted, and unless they're a full admission for 3 days, they cannot avail themselves of their Medicare benefit for rehabilitation being covered. And that's a big deal, because 1 month in a rehabilitation facility that is also a nursing home can run as much as $10,000 or $12,000. And people have to pay that out of pocket if Medicare isn't covering it. And Medicare's not going to cover their stay unless they were in the hospital as a full admission inpatient for 3 consecutive 24-hour periods, 3 midnights. So that is a huge problem. There's been a huge outrage over that. Consumer advocacy groups have risen up, and some amendments to the law have happened. As of March 9th of this year, hospitals are legally bound to serve patients with something called a MOON notice. MOON stands for Medicare Outpatient Observation Notice. And what that means is within 36 hours of being in the hospital, the care managers have to serve you that form if you are an observation patient. And I would encourage all of our listeners, if they find themselves in a situation that might require post-hospitalization rehab, to ask every single day in the hospital, am I inpatient, am I observation? And that will tell you whether or not you're going to have to pay for post-hospitalization care on your own or not.
And how many seniors or their caregivers are supposed to be aware of this, or were aware of this before the outcry? I mean, is this something that was Was it something that was slipping through the cracks and needed to be addressed upon further investigation, or was this a deliberate attempted subterfuge?
Well, I think it was a scam, honestly, Neal. What happened was technically the government said, hey, we're having too many revolving door kinds of patients. We want to cut down on Medicare fraud from people being admitted and then readmitted within 30 days. So Medicare looks at readmission within 30 days as faulty discharge planning. Sometimes it is, sometimes it's not. But hospitals are covering themselves from too many 30-day readmissions that will get them steep fines by Medicare by admitting over 50% of seniors are being admitted as observation patients, because then if they come in for 2 or 3 days, they get discharged and then they come back within 30 days, and the hospital's not going to get this little red flag that goes up to Medicare. So the whole thing really comes down to money and cost containment for hospitals. Hospitals found that there were a lot of really negative aspects of the Affordable Care Act for them. And as the public knows by now, there's really very little affordable about the Affordable Care Act. All costs have really gone up dramatically, especially insurance costs. And so insurance companies and hospitals have been getting hit really, really hard by the impact of the Affordable Care Act, and unfortunately it translates into higher health care costs for most consumers.
You've written the book, Patient Advocacy Matters, the ultimate how-to guide. Obviously, you're trying to expose more of these technicalities, we'll call them, like this observation status versus actual hospital admittance. Who knows about that? Well, basically, nobody. What are some other things that we can be on the lookout for and be educated about if we pick up a copy of your book?
Well, one of the things that most people don't realize about the whole inpatient observation status particularly is that you're going to get more private out-of-pocket costs if you're admitted as an observation patient. There are extra charges that the hospital can attach. You will be paying for all your medications. A lot of things are not covered when you're outpatient observation. Observation is paid by Medicare Part B, and inpatient is paid by Medicare Part A. So there are a lot of extra add-on expenses if people are admitted as observation patients. And there are some good aspects of the Affordable Care Act for patients. One of them is the closing of the donut hole. The donut hole refers to out-of-pocket expenses for expensive medications. In the old days, patients would have the first $2,500 of their Part D Medicare expenses paid for by Medicare, and then they would have the next $4,000 they would have to pay out of pocket before Medicare would start paying for that again. Now, over the last few years, that donut hole has been shrinking, and by 2020, they hope that it will be completely closed. And what that means is seniors will be getting higher benefits for medication coverage costs. The unfortunate little thing that has to do with that is some medications, particularly expensive medications, are being taken off the Medicare formulary. So fewer medications that are high cost are actually being covered by Medicare. So today, Neal, really it's all about cost containment, and people need to be informed consumers. Medicare.gov has a lot of great material about changes to healthcare law in America. And right now we're kind of in a never land where we're not sure whether or not we're going to repeal and replace, we're going to amend, or we're going to trash everything and start all over. I think probably the most informed people are saying that we're going to have to just modify the Affordable Care Act to improve some of the negative parts that have impacted consumers so badly and move on and still cover as many people as we can in this country. But right now we have a system that's not financially sustainable. So something is going to have to change in the healthcare law in America Otherwise, we're just going to eventually run out of money. So it's a very hot topic, and Americans are used to having access to health care and feel that it's our rights. But we spend so much money in this country on health care that surely something has to change. You talk to anybody in the insurance industry, hospital industry, or big pharma, and they know that some of the things that are happening with the system we have right now are just not going to be good for consumers or companies that serve consumers.
Is there a website where we can get some more information about your practice and get a copy of the book, Patient Advocacy Matters, The Ultimate How-To Guide?
Sure. The easiest and fastest way to get a copy of Patient Advocacy Matters is either on Amazon or Barnes & Noble, and it's $16.99. It's a fast read. I have a lot of stories in there that indicate that illustrate, common problems that consumer advocates encounter. And our website at our company is www.northshorern, all one word, .com. And that's www.northshorern.com, and you can find out more about how private advocates work and look at some frequently asked questions and get access to a lot of educational materials.
What every senior should know about hospital observation, admittance, Medicare, and Moon. Teri Dreher has been our guest, returning to talk with us about Moon, the Medicare Outpatient Observation Notice, and her book, Patient Advocacy Matters, The Ultimate How-To Guide. Thank you so much for coming back and talking with us, Teri.
Thank you so much, Neal. It's always a pleasure to be on your show.
You've been listening to Health Professional Radio. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page when you visit us at hpr.fm and healthprofessionalradio.com.au.